Welcome to the deep dive. Okay, so today we are plunging into, well, a medical field that, let's be honest, can feel incredibly vast
Uh-huh.
and maybe even a little daunting when you first bump into it. Rheumatology.
Yeah,
We're talking about, everything from everyday joint pain right up to these really complex autoimmune conditions that can ripple throughout the body.
it absolutely covers a huge spectrum. I mean, mastering it requires understanding not just isolated conditions, but how they connect,
Right.
how they present differently, and the underlying mechanisms. For students or, busy practitioners, finding a clear path through all that complexity is just crucial.
And that really brings us right to the source material for this deep dive.
Yeah.
It's a resource specifically designed, it seems, to guide you through that exact challenge.
Okay.
We're looking at 100 questions and answers in rheumatology for medical students by Dr. Atef Ahmed.
Got it. So our mission today really is to explore what this particular resource offers you, as a learner.
Hmm.
How does it structure aim to cut through the noise,
Yeah.
help you grasp the essentials quickly, and maybe even feel more confident tackling this field.
Let's dive in then. The source material, it starts by highlighting the author, Dr. Atef Ahmed, describes him as a distinguished figure in medical education.
Ah, okay.
And that detail kind of jumps out at me because it suggests this book isn't just knowledge compiled by a clinical expert, right?
Yeah.
But potentially structured by someone who really understands how people learn complex medical info.
Well, what's particularly interesting about that background is how it seems to shape the book's whole approach. The Force zeroes right in on the core format, questions and detailed answers.
Yeah.
It argues this isn't just a layout choice, it's meant as an interactive method,
Hmm.
specifically designed to promote active learning.
That makes total sense, doesn't it? Instead of just having information presented passively, like in a standard text,
Mhm.
you're immediately engaged by a question. You have to think, try to recall, maybe figure it out.
Yeah.
Then you get the detailed answer. And the source claims this Q&A method is really key for boosting retention and making those, often complex concepts feel a bit more accessible, more digestible.
Precisely. It shifts the learning from just receiving information to actively processing it,
Yeah.
which is well, it's a much more robust way to build lasting understanding,
Yes.
especially in a field like rheumatology with so many interconnected pieces.
Okay, now let's talk scope. The source material makes a point of saying that this book is comprehensive.
Right.
It apparently spans from the foundational stuff, basic pathophysiology, really getting at why diseases happen at a cellular level.
All the way up to advanced clinical scenarios.
So it suggests it aims to provide both that bedrock understanding and the practical application you need.
hmm And the source emphasizes it covers the, quote, full spectrum of rheumatologic diseases.
And they really back that up. There's a pretty extensive list mentioned right in the source. We're talking common conditions like rheumatoid arthritis and osteoarthritis.
Sure, the big ones, but also inflammatory conditions like psoriatic arthritis and ankylosing spondylitis.
And crystal diseases like gout, of course.
Yeah,
Then widespread autoimmune disorders like systemic lupus, erythematosus lupus. Yeah.
right, lupus
Oh.
and Sjogren's syndrome and inflammatory muscle and vessel conditions like polymyalgia rheumatica, uh, vasculitis.
Plus connective tissue diseases like myositis and scleroderma, some rarer conditions like Behçet's disease.
He's going.
It does. Pediatric issues like juvenile idiopathic arthritis, things that follow infections like rheumatic fever.
Okay, wow.
The list continues with reactive arthritis, antiphospholipid syndrome, mixed connective tissue disease, even chronic pain like fibromyalgia, vascular things like Raynaud's phenomenon.
And surprisingly, it even touches on arthroplasty, joint replacement surgery stuff.
That list really does underscore the breadth, doesn't it? Both of the field and what the book claims to cover.
It really does. It's tackling everything from like degenerative joint issues to these big systemic illnesses that can affect almost any part of the body.
What really stands out to me, though, from the source's description is the emphasis they put on practical application.
Oh, okay.
It talks about baking in real-world scenarios and case-based questions. So the idea is this isn't just about memorizing facts.
Right.
It's supposedly designed to prepare you for the actual clinical challenges, the decision-making you'd face, in practice.
And that raises such a key point about medical learning, doesn't it?
Yeah.
How do you bridge that gap between textbook knowledge and actually caring for patients?
Exactly.
Case-based learning is, well, it's a widely recognized method for simulating that clinical reasoning process.
Mhm.
And the source implies the Q&A format is really leveraged for that specific purpose.
And naturally, in a field that changes so quickly, the source also assures us it aligns with the latest guidelines and evidence-based
Which
practices.
is critical.
Absolutely. Keeping information current is essential in medicine.
Yeah, out-of-date medical information can be more than just useless. It can be misleading or even harmful. So, yeah, that alignment is a really critical point for any learning resource today.
So who is this book for then? According to the source, they outline a few key audiences.
Okay. Well, it seems primarily positioned as uh, an indispensable companion for medical students,
Right.
a tool to provide clarity on concepts that, like we said, can feel pretty overwhelming at first.
But it also seems to target aspiring rheumatologists, presenting itself as maybe a foundational step for those thinking about specializing.
Yeah, offering insights into the field's nuances, perhaps.
And then, broadening out even further, they suggest it's valuable for any healthcare professional who's looking to deepen their understanding of rheumatology.
hmm Whether that's for ongoing learning or just as a quick reference.
So it sounds like it's built to be quite flexible. And the source explicitly mentions its use for specific learning tasks too.
Like what?
Exam preparation, quick review sessions, and importantly, self-assessment.
Ah, self-assessment.
Yeah, not just for formal exams, but maybe checking your understanding during clinical rotations, that kind of thing.
That self-assessment piece is just vital, isn't it? Being able to test yourself, see where your knowledge gaps are. It's such a powerful way to consolidate learning.
So if we kind of synthesize the overall value proposition that's presented in the source material, this book is pitched as something more than just a collection of facts.
Right, it's framed as more like a direct pathway towards, well, mastering rheumatology.
hmm
The source claims it enhances your learning process, fosters a deeper comprehension of the whole field.
And ultimately equips you with both the necessary knowledge and the confidence to actually apply it.
It really seems designed to help you build that solid understanding of rheumatology fundamentals
Yeah.
and bridge that crucial gap to clinical application, guiding you towards becoming, a more proficient practitioner.
It aims to be that essential resource as you navigate your rheumatology journey, basically.
Which leads us nicely to our final thought, really building on the core structure of this resource we've discussed.
Okay.
How does learning a complex, evolving medical field by actively tackling specific questions and real-world scenarios, like in this Q&A format, how does that potentially change your approach compared to maybe just reading chapters in a traditional textbook? What advantages might that kind of active engagement offer you as you learn?